Dr. Tansavatdi, it is Tuesday, what is it, May 24th. We're getting far into May. But I posted that we were going to do a live demo on lip augmentation, and we have a beautiful model here today with us who has graciously said yes to getting her lips filled. And are you excited?
Yes.
Okay, good. Well, today I want to do a demonstration because our last video I just talked about, you know, what kind of fillers should be used, how to avoid duck lips, how to get the most natural lips. And so I'm going to show the anatomy today with our patient here and show you what we're planning on doing. All lips are different, you know, they come in different shapes, sizes. And so I'm going to talk about her lips and then point out what I'm going to do. So we're going to bring the video closer when I get time to inject. But I would like you to come a little bit closer. And again, check us out on all our social media channels. So please check these locations out if you can see the screen here with all our social media channels. Okay, that way you can keep up to date with what we're going to post next. All right, so come on closer here. Is it okay if I say your name?
Yes.
Okay, so Lori, Lori has, if you come closer to the lips, you need to come quite close. Sorry, the video, the cameras are right on you.
It's okay.
But her lips are very, very beautiful. She's already got some good volume. But as we age, we start to lose the border. We're already putting on numbing cream right now, so if you see that glistening, that's what it is, so that she can be comfortable for the injection. But the border here, you know, she's got not quite got that nice roll. And if you have younger lips, you'll see that roll, but as you get older, this flattens out. Right, Lori? You're just
unfortunately.
you want to get a more defined lip, then we do this injection along the border of the lip. But we don't want to do too much either, because that duck lip that people are afraid of, that's when you put too much filler along that border. Or if you put too much volume too as well, you can cause duck lips. So she's got good volume in both upper and lower, but she has more in the lower. And there should be a ratio that we look at that is natural, and the lower lip should always be bigger than the upper lip. But it's usually a 1/3, 2/3 ratio. And so with hers, I think that she could add more, we could add more volume in the upper lip to get it to be a little bit more symmetric with the lower lip. The other thing with Lori is that she has just some folds starting here, and it's causing the lips to downturn here. And that's where we see a smile turn upside down to a frown, and we don't want to get that as we're getting older. So I'm going to address that too with the filler that we have left. But first, our main priority is to augment the lips. The last part is this Cupid's bow. We all have a natural filtral column. I don't know if you can see in my lips. There's a column on either side, and we start to lose that as we get older. And so for her, I will also add a little bit just to the end that just gives it a nice, definition to the lip. All right, so we're gonna get started. Let me wash my hands. Actually, apply some Avogard, this stuff that I've been putting on my hands all morning because I was operating, and sorry for the delay. We were behind schedule, and that's why you see all these marks on my face. That's from the surgical mask, so I'm sorry about that. All right, we're gonna get the gloves and we're gonna wash off the numbing cream before we get started, okay? And Lori, you have a lot of hair, so I'm gonna try to get that hair out of the way so it doesn't get in the way. Got some alcohol. So we're gonna wipe away that numbing cream. Does it feel pretty numb at this point?
It's very numb.
It's been sitting there for a while, right, Lori?
Yes, I think I'm good.
Okay, we didn't get any on your tongue?
No.
Okay. Now there's many ways to block the lips. Usually the numbing cream is sufficient, but some people, I will do a lip block just to create more pain coverage, but most people don't need it. So I'm going to have you rest your head back a little bit so you're not moving on me as we start doing the lip injection. So you're going to come close so we can just show a little bit. What I like to do first is always do the lip border first, but everybody has their own technique. But I'm going to just poke right there, And we're gonna just go right under the border. Don't want to do on the border itself. I just want to create a little tiny definition. And I inject as I'm coming back a little bit, and I don't like to inject this one too deep. I mean, too superficial. Sorry, too close to the surface. Now this filler is Juvederm. This is Juvederm. If for those people out there who are wondering what this is, it blanched a little bit because she has, this has a little bit of lidocaine. Again, so just a little bit, causing just along the border. Is that your phone? My phone. Okay, all right. Actually, maybe. Anybody squeamish out there? Just trying to poke away all that blood there. All right, now just a little bit in the cupid's bow, a little bit, just a little bit, just to cause a nice roll. Okay, and it's helpful to start arnica before you come in for those people who do bruise or bleed easily. Okay, now I don't know if you can see this, what's happening, but we're just outlining her lip border here. Okay, so now she's got a nice roll, and the lower lip is slightly swollen too, just from that injection. I'm going to add a little bit more volume to the upper lip, and then we're going to come down to the lower lip. Okay, that was just okay. Okay. Go a little bit lower here, just to add some volume. Sorry that you're seeing the blood for the people who are maybe squeamish of this. Okay. Laura, you didn't start any, you're not on any official, right?
No.
Okay. Let's come over to the other side here. All right. Okay. So now we want to make sure that everything's symmetric. Looks pretty good. Trying to wipe away all the blood so you can see her lips. Okay. Any pain?
No.
Okay, good. Now we're going to start on the lower lips. Slightly open. Okay. So for the lower lips, try to outline the border a little bit. Not so much. The border doesn't lose as much as in the upper lip. I'm trying to get out of your way so you could see as well. So, but you could start to see the roll that's happening. Okay. Now we come over to this side. Now I don't want to put as much volume on this lip compared to the upper because she already has a bigger. Okay. Okay. Lori, you comfortable still?
I am.
Okay, good. Now the lip injections, we really want to be slow and methodical. I don't want to go too quickly. We want to make sure that it's all symmetric. Okay, now just going to add a little volume. I'd like to do more the center than the sides, because if you add too much to the sides, you get quite a bit of volume where it's not supposed to be. We're supposed to have more volume in the center of our lip rather than the outside of our lip. Okay. Okay, we are done with volume here. Okay, I'm going to wipe everything down. We're going to show Lori, because everybody else can see, but except for Lori, how she looks. Okay, we already chatted a little bit about this before we started. Okay, Lori, before we move on, I just want to show you your lips.
Wow. Much nicer.
Yeah, just a better version.
Yes.
Okay. Now we're going to add a little to the droopy areas. Before we go, I'm just going to add a little bit to the filter columns. Remember I said right here, she didn't have as much here. So just a little add here. Okay. And just a little right here. Okay. Creates just a nice little definition right along that lip. Okay. Now the last part is taking care of these areas at the corner of the lips that are causing the lips to draw down. Okay. Still pretty comfortable?
Yes.
Okay. A little bit of massage in that area. You can see that that has filled in the area pretty nicely. Do the same on this side. And we are on the home stretch. Okay. Last part. Over there. Okay. Doing this just so you guys can see a little bit better. Hopefully you guys can. Trying to get my hands out of the way. It doesn't make any sense if you can't see what I'm doing. And we are done. All right. So please put your comments, questions. I know this looks painful, but believe me, she's comfortable. Are you comfortable?
I am comfortable.
Okay. Any pain through all that?
No.
Okay. So if the numbing cream's on long enough, you probably feel maybe some pressure, initial needle pokes, but after that, everything is pretty comfortable. All right, and that's it. So please tune in next week, next Tuesday. We're going to be talking about revision rhinoplasty. I do a lot of rhinoplasties in my office, not in the office, sorry, in my practice, and field questions for that YouTube live question and answer session, but also through Periscope. So tune in next Tuesday, that's after Memorial Day weekend. Enjoy your weekend, come back and follow me on my social media channels. Okay, thank you.